Hello, and welcome to another day of Living with Spina Bifida. Today is Mental Health Monday. May is Borderline Personality Disorder Awareness Month, and a lot of people are using it for mental health awareness as a whole, but me having borderline personality disorder and it being fairly common, but people don't know a whole lot about it, I think it's important to shine this in the limelight as its own awareness. Borderline personality disorder is a pervasive pattern of instability in interpersonal relationships, self-image, and emotions. People with borderline personality disorder are also usually very impulsive, oftentimes demonstrating self-injurious behavior, risky sexual behaviors, self-harm, and suicide attempts. Borderline personality disorder occurs in most by early adulthood. The unstable pattern of interacting with others has persisted for years. It is usually closely related to the person's self-image and early social interactions. The pattern is present in a variety of settings, not just at work or home, and is often accompanied by similar lability fluctuating back and forth, sometimes in a quick manner, in a person's emotions and feelings. These individuals are very sensitive to environmental circumstances. The perception of impending separation or rejection or the loss of external structure can lead to profound changes in self-image, affect, cognition, and behavior. They experience intense abandonment fear and inappropriate anger, even when faced with a realistic time-limited separation or when there are unavoidable changes in plan. In reaction to a clinician's announcing the end of a session, hour, panic, or fury when someone important to them is just a few minutes late or must cancel plans altogether. They may believe that this abandonment implies that they are bad. These abandonment fears are related to an intolerance of being alone and a need to have other people with them. Relationships and the person's emotions may sometimes be seen by others or characterized as being shallow. Personality disorder is an enduring pattern of inner experience and behavior that deviates from the norm of the individual's culture. The pattern is seen in two or more of the following areas: cognition, affect, interpersonal, functioning, or impulse control. The enduring is inflexible and pervasive across a broad range of personal and social situations. It typically leads to significant distress or impairment in social, work, or other areas of functioning. The pattern is stable and of long duration, and its onset can be traced back to early adulthood or adolescence. A person with this disorder will also often exhibit impulsive behavior and have a majority of the following symptoms: frantic efforts to avoid real or imagined abandonment, pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and de-evaluation, identity disturbance, such as a significant and persistent unstable self-image or sense of self, impulsivity in at least two areas that are self-damaging: spending lots of money, sex, substance abuse, reckless driving, binge eating, recurrent suicidal behavior, gestures or threats, or self-mutilating behavior. Emotional instability due to significant reactivity of mood, intense episodic dysphoria, irritability, or anxiety, usually lasting a few hours and only rarely lasting up to a few days. Chronic feelings of emptiness, inappropriate intense anger, or difficulty controlling their anger. Frequent displays of temper, constant anger, recurrent physical fights, transient stress-related paranoid thoughts, or severe dissociative symptoms. Because personality disorders describe long-standing and enduring patterns of behavior. They are most often diagnosed in adulthood. It is uncommon for them to be diagnosed in childhood or adolescence because a child or teenager is under constant development, personality changes, and maturation. However, if it is diagnosed in a child or teenager, the features must have been present for at least 1 year. Now, even though it is fairly difficult to get a young person diagnosed with borderline personality disorder, it is not uncommon to be diagnosed as an adult and then look back on your childhood, on your teenager years, and say, it makes a lot of sense. Everything, all the pieces are being put together now. I had it all along and just nobody realized it. I myself have done the same thing. My childhood was greatly difficult for many reasons, and being diagnosed with borderline personality disorder as an adult and being diagnosed with borderline personality disorder as an adult, I can look back on my childhood, on my teenage years, and think, yeah, that makes sense. It's been there the whole time, just nobody realized it or wanted to say that was the reason. Like most personality disorders, borderline personality disorder typically will decrease in intensity with age, with many people experiencing few of the most extreme symptoms by the time they are in their 40s or 50s. So, like I said, it is Borderline Personality Disorder Awareness Month. And that's what I want to do, is make people more aware of this disorder. So I want people to ask any and all questions that they might have, either related to the disorder as a whole, how I have dealt with it, just any sort of question related to borderline personality disorder. I welcome you to ask those questions, so we don't have to be stigmatized. We don't have to be looked at as the angry, immature, out of control, dangerous people that we are looked at as because of the intensity of our feelings that are constantly there. I want people to realize that we are people. We just feel a little deeper and a little more than other people do. And sometimes we have difficulties with expressing those feelings properly. And a lot of times we don't even have control over the way we are expressing those feelings. We don't want to be having an episode. We don't want to be yelling and screaming and saying the most horrible things to our loved ones, maybe to even strangers. But sometimes we just can't stop. And I can speak for myself saying that it's not as easy as just taking your medication, going to the psychiatrist, in any sort of mental health issue. Those are not cure-alls. Just take it one step at a time, one day at a time, and talk about it. It's okay if you have a mental illness. It's nothing to be ashamed of. You didn't do anything wrong. The only wrong thing is the stigma. The only wrong thing is the negative thoughts towards the mental illnesses. So I am here to inform people, to show people that we're here and we're okay and you're okay because we're here.